CRPS is complex regional pain syndrome, as it's abbreviated. It's a form of a chronic pain that usually affects your arm or legs. In CRPS, the pain typically develops after an injury. Sometimes the injury can be severe, or sometimes injury can be seemingly trivial, like a needle stick or thorn prick. It can be a surgery, it can be a stroke, it can be a heart attack. The one point that needs to be noted over here is pain is completely out of proportion to the severity of initial injury, and it does lead to a lot of long-term debility. In CRPS, there are sets of signs and symptoms which were previously described by International Association of Study of Pain, which we call as IASP as abbreviated. Previous criteria was Budapest criteria, and now the current criteria are Valencia criteria. Without going into much nitty-gritty of details, it usually feels like continuous burning or throbbing pain in the affected region. It can be your arm, it can be your leg, it can be your foot, it can be your chest. There's a profound sensitivity to touch and cold. There is a profound swelling of the region as well. The region looks angry, region looks red. There are changes in your skin temperature. It can alternate between being a very sweaty palms to very cold feet. The skin color can range from, like I said, from angry red to blotchy blue, which is, it was classically, patient describes them as my foot is always blotchy blue. There are changes in your hair and nail structure as well. Sometimes your nails can be ingrowing or outgrowing. Sometimes you find that the affected region has a change of a color of your hair, or the hair becomes shiny, hair becomes thin, hair becomes brittle. There's joint stiffness, swelling. There are changes in the way the alignment of joint is. Sometimes the joint looks quite crooked as well. There is a spasm, there are tremors, there's a weakness, and there's a generalized loss of muscle, which we call is an atrophy in the medical terms. There's a decreased ability to move that body part. The first and foremost is patients do describe that they are not able to wear socks, they are not able to wear stockings, they are not able to wear gloves. And this is where our suspicion towards the CRPS grows up. Having said that, CRPS needs to be diagnosed by a specialist. It is a diagnosis of exclusion. It is usually overdiagnosed, and I would say it's overdiagnosed as an anomaly, but I would think that it's a pain specialist, it's a neurologist, it's a physiotherapist, or it's the orthopedic surgeons who are best placed to diagnose the CRPS, and they will do it with scientific criteria. There aren't very many tests to diagnose the CRPS. In research world, there is a test called as quantitative sensory testing, but it's not available in the normal clinical world. There are various stages of CRPS, starting with the acute stage, which lasts for about 3 months. During this stage, this is where the patient experiences the burning type of pain. They will mention that my foot is on fire, my hand is on fire. There's a swelling, there's an immense amount of sweating. Patient will tell you that they are not even able to write on the paper as well, because the sweat is completely dripping off their paper. There's a decreased range of motion. Then the gradual progression happens after 3 months to something which we call as a subacute stage. During this stage, there is a continued severe pain, but the throbbing nature is now more profound. There is a generalized dryness of the skin. The dryness is so severe that sometimes the skin starts to break up. There is a paleness and blotchy blue discoloration of the skin as well. And after 12 months, what we call is a chronic stage of CRPS, or it can last for multiple years, if not decade, or even can become permanent in few cases. This is where the patient's pain is variable. It does have a seasonal variation. It does have monthly variations. It does have various exacerbating factors to it as well. Skin appears dry, shiny, cool to touch. Sometimes patient is not using their extremities at all. They haven't used their hand for years together, and those changes can be seen on their muscles. Those changes can be seen as a permanent deformity in their joints. And this is where the affected region, the bones, are starting to become more brittle. You can actually notice that the one of the foot appears completely thin than other foot or hand for that matter. CRPN can last for a long time, and it makes it absolutely impossible for someone to continue in their normal line of work. Anyone can expect that they can be out of the work for at least 12 months following the diagnosis of CRPS. Having said that, there are various occupational health and occupational specialist therapists, which are part of multidisciplinary team to treat CRPS. The aim of inputting in the multidisciplinary manner is to reduce this permanent disability. But yes, CRPS does have a profound, long-lasting effect on the patient. CRPS usually tends to be non-fatal as such, but the severe mental insult that it has on the patient, have seen patient having suicidal ideation, self-harm, complete loss of social interactions. They have stopped taking their regular medications like blood pressure medications or diabetic medications, which can then again lead to the complications. So I would say CRPS as such is not fatal, but it's the sequelae, especially with relation to the mental health, that happens with the patient, which can lead to fatality. Classically, CRPS used to be treated with 4 Ps or 4 pillars of CRPS that used to call it. First and foremost is physical therapy or physiotherapy. There are various forms of physiotherapy, and aim of this physiotherapy is to prevent the long-term disability, is to prevent the long-term deformity of the patient. They can range from pacing and coping activities to graded mirror imageries. Then second part, which we come, is to have pharmacological therapies. Pharmacological therapies can be ranging from anti-neuropathic medications, which are the medications which stops the pain coming from the nerves, to simple medications, to strong painkiller medications, to various medications which prevents the osteoporosis, which is the brittling of bone. There are various other medications in terms of vitamin C tablets these days, which has been advocated by Royal College of Surgeons, is to prevent that progression of CRPS. Vitamin D tablets have been used in recent times to prevent the progression of CRPS. Then we come to the next part of the P, which is the pain management. Again, the pain management has to happen in a multidisciplinary module. A pain management specialist can suggest various pain relief injections, nerve blocks, sympathetic blocks. Sympathetic blocks can range from lumbar sympathetic blocks or stellate ganglion blocks, which are performed at the neck level. The idea of these blocks is to decrease the sympathetic drive, which drives this pain. There are various other modalities which are approved by the NICE, which is National Institute of Clinical Excellence, which are spinal cord stimulator, dorsal ganglion stimulator, and last but not least is the surgical input as well. Sometimes you may need a surgical input to correct the deformity at first, to correct the bony spurs which are leading to the chronic pain. Last but not least, amputation is also one of the options of CRPS as a last ditch resort. Last P is the psychological input. The impact of CRPS on mental health cannot be described in the word. It is very important that patient receives the psychological help. They may also need to be referred to liaison psychiatrist because of the depression, anxiety, pain avoidance behavior, pain-related behavior, fear avoidance behavior. All these can be corrected with CBT, which we call as a cognitive behavioral therapy, or ACT, which is acceptance commitment therapy. There are various other mindful basedness technique which helps patient regain their mental composure, and this is one of the most neglected aspect of the treatment, but I would think that this is the most important aspect of the treatment.